If you're having pain on the back of the elbow, in this video I'm going to go over what is tricep tendinopathy or tendonitis, and then how can you treat it at home. A tricep tendinopathy or a tendonitis issue is going to be right here in the back of the elbow and the back of the arm here in this section right here where this kind of white connective tissue is. That's a common area to have this inflamed. This tendon is connecting the three heads of the tricep muscle here to the bone, and when that contracts, that tendon pulls on the bone and allows us to straighten out our elbow. This is a common area you can have irritation, inflammation, and so if you are trying to resolve this issue, in a lot of cases people underload the tissue. They don't go through strengthening exercises properly. They just maybe stretch it a little bit, put heat on it, take anti-inflammatories, maybe even get a massage done, and it doesn't really resolve the issue for the long term. We want to resolve this completely so that you're able to return to whether that's work, sports, or just daily life. So we're going to go through this in three phases. We're going to say that phase one is that acute phase. Either you've just injured your elbow, your tricep tendon, or maybe it's been going on for a while and you just haven't done anything about it. Now you're going to start to do something about it. So phase one is going to go through about 2 weeks, so 7 to 14 days, and then we'll progress on to phase two and phase three. In phase one, we're going to focus on stretching, really do a lot of stretching in the area of the tricep. We're also going to work on some isometric loading, and then continue to apply things like moist heat or cold, whichever you prefer. I personally prefer heat, especially after the first 48 hours or so. I like to use heat in the area. Again, that's just preference for you and just really what you want to use. So our first thing we want to work on is continue with that moist heat or cold, and then we're going to add in our stretches. We're going to say it's my left elbow that's irritated and inflamed. I'm going to go with a stretch just kind of across body. I'm feeling this pull here. Cross body, I'm going to hold that somewhere between 20 to 30 seconds. And I repeat that several times a day, just all throughout the day. You also can do that up behind the head and pull down like this. That's fine too. You're going to not only feel that at the elbow, you're going to feel that on the back of the shoulder where the tricep crosses the shoulder joint. And that's something I would do really on day one. As soon as I could start doing some light stretching, don't get too aggressive with that. Go with gentle stretching and then progress in as you can tolerate to go all the way to fully bending the elbow and holding that again for 20 to 30 seconds, just repeating several times a day. Next, we're going to work on isometric loading. Remember, we want to start loading the tendon as quick as possible without overloading the tendon. I'm going to use one of these exercise bands. You can fasten these to the door, to a hook, or just kind of whatever you have at home to safely fasten it. If you don't have somewhere you can fasten it, you can hold it with your unaffected hand up high and then pull down and straighten out your elbow. So that's what we're going to work on, is straightening out the elbow. We're going to hold it out there, really contracting the tricep. Hold it out there straight, 5 to 10 seconds, and relax. Right? Then we're going to go back out again, hold it there, 5 to 10 seconds and relax. And then again, 5 to 10 seconds and relax. So there is a little bit of movement there just for me, kind of readjusting, but ideally would be whenever you finish holding, you would just take the slack out so there's no tension and pull straight back out again. Really feeling that in that area, because with those isometrics, you're going to be able to load the tissue without over irritating or aggravating. Just that continual movement can irritate that area. So you're going to do that in that first phase for that first 7 to 14 days, and then we're going to progress on to phase two. Now that we're in phase two, this is going to take place somewhere between about day 14 to maybe 16. This is not an exact time frame, but just a rough time frame that I would go through. One thing to remember is it's not uncommon to have pain during this entire process. You are going to have pain and irritation. It should calm down after you stop your exercises, your activities. However, if it doesn't calm down within a few hours, then you want to back off because the load or the amount of resistance that you were using was too much. So it's normal when you have a tendinopathy, a tendonitis issue, to have that pain and discomfort. In fact, if you aren't having some discomfort, you're probably not loading the tissue enough. Now we're going to work on eccentric exercises here. Now with this, I'm going to use this pulley system. You can use that same band that I just was using in the previous exercise. That's fine. What we're going to do here is I'm going to take all the slack out here. I'm going to straighten out my elbow all the way straight. Now, as far as position, you can position yourself, ergonomically so it feels good in your shoulder and all that. And what I'm going to do now is slowly let my elbow flex and bend here. Okay. And then when I get to the end, I'm going to do all the work with my unaffected hand, straighten that back out, got my elbow back out straight, and then slowly lengthen this tissue on the back here, just while really lowering it or under control. And we're going to do that for around 2 to 3 sets of 10 to 12 repetitions. A point to make with that is to be careful. If your resistance level is too much, you can really over-irritate the area, so we don't want to do that. Want enough load where you can control it. At about that 8th, 9th repetition, it's getting a little difficult. By 10, 11, definitely difficult. By 12, you feel that burn in, and then you're kind of pegged out there at 12. If you're able to do that for 15 or 20, 25 repetitions, the load is not heavy enough to accomplish what we want. So increase the resistance level or the load that you're using and back off on your repetitions. Also in this phase, you're going to continue with those stretches that you were doing before. You're going to continue to stretch all throughout the day. You're also going to continue with using your heat. You can also use a massage gun if you have one of those percussive massagers. You can use that in the area, the tricep, just to try to bring some blood flow to the area and really just kind of calm things down and make it feel a little bit better. Those are great techniques to also use, and you're going to continue that the entire time during phase 2. While in phase 2, we're going to start doing a little soft tissue work. Cross-fiber friction massage or the use of these massage or muscle scraping tools in the area works really well at reducing pain as well as kind of providing kinesthetic awareness that gives that input to the tissue, especially as tissue has been inflamed. You can use all sorts of tools. They can be metal, they can be plastic, stone, whatever. It doesn't really matter what you're using, in my opinion. So we're just going to pull up here my sleeve, and you're just going to go in the entire area, just a light scraping all over the muscle belly. I'm going to go over the tendon a little bit here. Doesn't have to be aggressive. Be careful because the radial nerve is in here, so you don't want to get too aggressive with that. And I'm going to spend maybe 1 to 3 minutes doing this in the entire area, and that's something I would do typically once a day. Now, I typically begin phase 3 at around 3 weeks or so, maybe a few days later or a few days earlier. It just depends on how you feel. First thing we're going to start off with is a rope press down or tricep extensions. I like this handle system here. This is a really ergonomic system. You can use whatever kind you like. It doesn't matter to me, really. It's just preference whether you want your palms facing forwards. Do you want your palms facing down? Some people do it supinated or palms facing upwards. Just whatever feels the best on your elbow when you're going through this. All that you're going to work on here is keeping the elbows by your side and just going into that extension there. Nice and controlled. This is going to be called an isotonic because we have both the concentric, where I'm going out, and that eccentric like we performed before coming up. And I'm going to do that for 2 to 3 sets of 10 to 12 repetitions, and we're going to do that once a day. This exercise I really like. This is a dumbbell kickback, and what you're going to do is keep the elbow kind of tucked into your side here. You're going to lean over, stabilize using a chair or a bench, whatever you have, and I'm going to push straight back. I'm just contracting my tricep back there, pushing all the way back, nice and controlled. 2 to 3 sets, 10 to 12 repetitions. Now, when using dumbbells, something I would caution you against is doing that behind the head dumbbell extension just like that. That exercise can really strain the tricep tendon, the entire tricep itself. I'm not saying it's a bad exercise. I'm just saying when you're recovering from a tendinopathy of the tricep, you might want to use caution with that and avoid that exercise at least for a while until things calm down. Hope these tips help to reduce your tricep tendon pain that you're having, restore your range of motion and your strength in order to return back to normal daily life. Thanks so much.